Hi, my name is Kale Evans. I'm a student nurse here at the Williston campus, and today I will be performing how to prepare piggyback medications, secondary line. So, first thing I'm going to do here is check my healthcare provider orders to my MAR. So I'm just going to make sure I got the same patients here. I got Miss Shirley Coast, a 54-year-old female with the date of birth on 5/14/1964 on my provider orders. And that matches here on my MAR, Shirley Coast 54, female, 5/14/1964. I'm also going to compare these allergies, so promethazine, codeine match both of them as well. And so I'll just need to be able to be on the lookout for those. So I am here in the med room right now. First thing I'm going to do is wash my hands, and then I can start with preparing my first of my medications. So right here, I noticed on the MAR that earlier today, another nurse had started some sodium chloride, just regular 0.9% NS, and then I'm just going to take note of that when I start preparing my medication, which is the ceftriaxone, 1 gram for IV administration, 1 gram of the ceftriaxone and 250 mils of NS infused over 60 minutes. I know that that's correct, and that we're going to be giving that for Miss Shirley's pneumonia infection. So I know that those two medications are compatible, so I can go ahead and proceed with preparing this medication. So out of the Pyxis, I'm going to pull my 250 ml bag that contains 1 gram of ceftriaxone. I'm going to notice there's no expiration, that the bag's not tampered with, there's no particles in it or anything like that. So I can go ahead and pull that from the bag. And again, making sure to just push or squeeze it a little, make sure there's no holes, there's no particles, and everything like that. So now that's my first medication check, and then I can go ahead and label that with the medication that's in it. So right here, I also have my med label that's making sure it's the same one on the MAR, so 1 gram of the ceftriaxone and 250 mils of the NS. And then I also just have my same patient identifier, the patient sticker, so it's just the same information as on my MAR. Shirley Coast 54-year-old female at 5/14/1964. Okay, so now that I have that all properly labeled, I can then go ahead and gather the rest of my supplies from the med room and go ahead into the patient's room. So the only things that I need is a secondary line that I'll be able to use, as well as a tubing label for it and my alcohol swab for once I prepare it. So now that I have everything, I can go ahead and exit the med room and enter the patient's room. I can perform hand hygiene, provide privacy, introduce myself to the patient, as well as gloving up. So I'm just going to introduce myself to the patient. Hi Shirley, my name's Kale. I'm going to be your nurse today. I just got here an order for some ceftriaxone that we're just going to be putting it through your IV. I see that you already have one running, so I'm just going to make sure, is it all right? It's running, doesn't hurt or anything? Okay, good. So again, that ceftriaxone is just it's just a little medication for your pneumonia. Is that all right? Any questions with that? No? Okay, perfect. So I did check the site, and I also did have before I'm going to administer, I'm going to have the patient confirm their name and date of birth for me. So she told me that her name is Shirley Coast and her date of birth is 5/14/64. I also confirmed that on her patient wristband. And I also asked her what her allergies are to any medications. She told me that it's to the promethazine, codeine, which also matches her wristband. So now that I know that I'm in the right patient's room and everything, I can go ahead and assess the site of the patient. So their NS is running good. There's no signs of infiltration or anything. So I can then go ahead and perform my second med check at bedside. So I have the ceftriaxone 1 gram in 250 mils of NS, so that all matches. And I'll be doing it in over 60 minutes, so I know that I'm going to have to set my rate to 250 mils per hour. So now that I got all of that ready, I can go ahead and start getting this ready to hang. So just pop this open. Okay, I'm gonna make sure that my roller clamp is all or shut and closed. Okay. Now I can go ahead and take this cap off, making sure to maintain sterility. Invert, insert into the bag. Okay. Make sure my roller clamp's still closed. I can then invert the bag and hang it. Fill my drip chamber halfway. And then slowly release the roller clamp so that I can get my line primed. Making sure you get all the air bubbles out. So I got all my air bubbles out, got that locked. And I can go ahead and clean the hub of this pump. And just connect it before programming. So that's connected. Then before opening that up, I'll just do one last check right after I get my settings in. So right here I have my Piggyback here. I'm gonna go to my drug list. I'm gonna go all the way down to antibiotic. Okay, so there's my antibiotic. I'm gonna go down one for the 250 ml bag. Go ahead and hit enter. Choose my standard program, and we'll be going in at 250 mils per hour with our 250 ml bag. So it's going to be going for 1 hour, and I know that that's correct because this will be my third and final med check. So I have the med, right? So it's the antibiotics, ceftriaxone, 1 gram, and 250 mils of NS over 60 minutes. So I have the 250 mils right there, and we're going in at 1 hour, so that's all correct, 250 mils in an hour. So I can then go ahead and hit start, and then that's again 250 mils an hour, 250, and we're doing the antibiotic, which is the ceftriaxone. Hit yes, okay, and while that's switching over, I can then open this up. And so now I'll just need to make sure that it's switching over correctly and that it is still flowing, which it is. And then I'm just going to make sure to stay with the patient for about 10 to 15 minutes to make sure that there's no signs of an allergic reaction or anything like that. Making sure to watch the sign or the site for any infiltration or any allergic reaction in that sense. I can clean up my station. And then once all that's ready, I can then go ahead and provide the patient some privacy by leaving the room, washing my hands before I leave the room. And then when I get back to the nurse station, I'm going to chart how the patient tolerated the medication, what we used for like the pump, what medication we were given, the rate, the site that we were administering it, as well as any medications that we're giving alongside of it.